All right, good morning and welcome everyone. Thank you all for joining us today. My name is Rebecca Guidros. I'm the Well Ahead Louisiana's Diabetes Prevention Coordinator, also co-lead of the Louisiana Obesity Diabetes Collaborative. I hope everyone has been doing well since our last meeting that we held in March. We're just very glad that you're all able to join us for our second meeting this year. Thanks for taking the time to connect with us during our meetings and on this Thursday morning, and then also outside of our meetings with other partnerships that you've all been involved in. So we have some great information and resources to share with you all today. So please stay on the entire time if you can. If not, we will, like I said, be recording this meeting and sending out notes. So here is just a quick glance at our agenda for today. I will start with a few announcements. We will also review our work groups and hear updates from our payer policy work group on legislation. I will then introduce our guest speaker for today, and we will have time for Q&A at the conclusion of the presentation. So please write down any questions or comments that you may have, and then please hold them till the end. And then we will conclude with closing remarks. So just a few staffing updates and announcements on some upcoming trainings and meetings that we're hosting. First, I wanted to let all of you know, I think some may be aware that Marcy Hubbs, our collaborative lead, was recently transitioned to a position outside of the Department of Health. So I will be leading today's meeting. I've been involved in helping co-lead the collaborative for several years now, so I'll be leading and helping with these meetings moving forward. We're hoping to hire someone soon to join the diabetes team, and hopefully they will be with us by our next meeting in September. In regards to the work groups, Brian Wilson, who was recently our chair, regrettably had to resign from that position as lead from the education and awareness work group. So there was a lot of things that just revolved around other work outside of his job that just he needed to focus his responsibility on. So he will still be involved and engaged with the collaborative. And in the meantime, Michael Peoples, co-chair, has gladly accepted to assume that role to help Brian out during his absence and keep the momentum going for that work group. Also, our Well Ahead's Provider Education Network will be hosting a webinar this month on overcoming initial barriers in implementing faith-based health promotion and disease prevention programs. And that is scheduled for next week on June 30th from 12 to 1. Also, our Diabetes Echo is still continuing to meet, and you can still join. The Diabetes Echo series provides a team of diabetes specialists to review case examples and give care recommendations. Each of these meetings provide a brief didactic presentation on diabetes-related topics as well. And the next session will be on Tuesday, June 29th from 12 to 1 p.m. And it will also be held every other Tuesday for the remainder of the year. Our next Oral Health Coalition meeting will be held on June 30th at 10 a.m. And just to let everyone know, I will include the list of the trainings and webinars and the registration information on the follow-up email as well. So our collaborative work groups are still trying to continue and meet and focus on their specific goals and have been generating plans to help meet these goals. On the slide, you will see the 3 work groups and the chair's contact information. If anyone has not already been involved in a work group and wants to join, please email the corresponding chairperson at the email listed on the website. On the slide, I'm sorry. And I would also just like to take time to say thank you to our work group chairs and co-chairs, and also the members in these work groups for their dedication, hard work to helping us improve diabetes and obesity in our state, and making a lot of resources and new things available for people in our communities. So thank you. You are truly making a difference with our collaborative. So with that said, I will now turn it over to Bonnie Email, Chair of our Payer Policy Work Group and Director of Institutional Relations with Pennington Biomedical Research Center. She will provide a brief summary of the legislative bills that focused on obesity and diabetes during the 2021 session. She will also discuss the Obesity Awareness Day and some of the work that they've been doing within the Payer Policy Work Group.
Good morning. June 10th was the last day of session. As we say, it was sine die. There were a few pieces of legislation that I thought the group would be interested in. And at the end of my presentation, I'd also like to encourage if any of you have some suggested legislation for the next regular session next year, please let me know. We had HR 31 by Representative Moore that was considered to talk about how do we get SNAP benefits healthier, although it died in committee. The next one was HRC 56 by Representative Freeman, and she is asking that Bessie and LDH work together and look at the best practices on issuing school-issued devices, knowing that some of the devices can enhance kids not playing outside, obesity, muscle issues with their hands. So that will be a study resolution. The next one was by Representative Duplessis, talking about mental health with women who are maternal depression. You get that with women who are in the middle of their pregnancy. So they talked about gestational diabetes and what may need to be looked at. So that's a study resolution. And they're asking that LDH develop an evidence-based approach to deal with this. Representative McMath just wanted to give a shout out to the North Shore for what they've been trying to do in their region. For the past 18 years, the bariatric surgeons have been trying to have bariatric surgery covered. This year they've been, and in previous years, they've tried to focus on Office of Group Benefits, which is the primary provider of health insurance for state employees. That was successful. And the governor signed the legislation last week. The legislation defines severe obesity. They're limiting it to 30 surgeries per year, and it's for active or retired state employees. It does not cover family members at this point. And they're requiring a pre-op should be no less than 4 months. It goes into effect August 1st, the legislation does. But I think the last that I heard, it would be better to really start the surgeries in the new insurance year. So for the state, it would be January 1st. The next thing is SR 245 and HR 215. You've heard about the TROA bill, which is Senator Cassidy and others have reintroduced in Congress the Treat and Reduce Obesity Act. When Medicare was established many years ago, there was no obesity drug on the market. So obesity medication is still not covered by Medicare. So this is the piece of legislation to try and have that done. CBO has been scoring it, so they're hoping to be successful. If we have any governmental affairs or any people on the call that has contacts with others around the country, Senator Cassidy is looking for both Republican and Democratic members to be authors of the legislation. So if you could let me know, I'd appreciate it, and we'll get that information back to Senator Cassidy. It is so important that this legislation be successful in this year. Lastly, we had HR 20 and SR 193, which recognized June 7th as Child Obesity Awareness Day. So Pennington Biomedical and the Louisiana chapter of the American Academy of Pediatrics teamed up, and we wanted to start educating members about the obesity issue and to create awareness for the day that talks about childhood obesity. It is such an issue in the state. So we had some of Pennington Biomedical faculty and the association. So Marcy Hauser, who is with the American Board of Obesity Medicine at LSU Health Sciences Center, and also is a faculty member at Children's Hospital in New Orleans, Dr. Katie McQueen with Our Lady of the Lake, and she chairs the Louisiana American Academy Pediatric Committee on Obesity and Nutrition, and she's a member of our Louisiana Diabetes and Obesity Commission. She could not be here today, but she was very involved, as well as Dr. Daniel Shaw with Pennington Biomedical. Dr. Stiano, who you'll be hearing from, also attended, and Ashley Politz, who is the executive director of the Louisiana chapter. It was great. We had a lot of positive feedback. The physicians really were able to make some contacts one-on-one with the legislators. They were in the House and the Senate chambers. They were recognized. So we think this was a great first step. We intend to do this in an annual way. We created flyers that all members received. And then we had we had t-shirts on, but also these signs, and we'll be doing more. This was our first step, but we'd like June 7th to every year maybe be the Childhood Obesity Awareness Day. So we thought that it was a great first step, and we'll be talking to legislators in the interim on are there other things that we can do in the state. If anybody is interested, we'd like to look at legislation that maybe in the country that would be something that we could do in the state. I know we're limited. We're always limited on state dollars. So there are some things that may not be very costly, but could be implemented in a coordinated way. We'd like to do that, and we'd like to enhance collaborations. So if you have any ideas, please let me know. Thank you.
Awesome. Thank you so much, Bonnie, for sharing all the updates on legislation. Sounds like we did get a lot of things passed and enrolled. So good to hear. Looking forward to seeing where everything is moving forward and moving in a direction that I know we've been trying to work on with the work group, but y'all have been doing a great job at Pennington and with all of your other partners. So we appreciate it. I will now go ahead and introduce our guest speaker. So we are very pleased to have with us today Dr. Amanda Staiano. Dr. Staiano has been involved with the collaborative for several years now. She's very committed to moving Louisiana's health forward in all the work that she does. She is the Associate Professor and Director of Pediatric Obesity and Health Behavior Lab at LSU's Pennington Biomedical Research Center. With degrees in developmental psychology and public health policy, she conducts weight management studies for children and families that use telehealth and technology. Her research is funded by the National Institute of Health, USDA, American Heart Association, among others. Today, Dr. Staiano will present on Obesity USA, a public health advocacy campaign developed to address the nation's growing obesity epidemic head-on. The campaign takes a visionary approach to not only raising awareness, but to shift public perception of obesity as a disease, dispelling the many myths that have long persisted and arming individuals and communities with the evidence-based research and the resources necessary to lead healthy lives. She will also provide a real-world example of how Pennington Biomedical Research and partners are tackling obesity through the Team Up study, which has tested family-based weight management strategies developed by doctors, nurses, dietitians, health coaches in primary care settings throughout Louisiana.
Thank you so much, Rebecca, and all of you on this call today. I've had the opportunity to work with a number of you, and I appreciate some of your time today so I can share with you Pennington Biomedical's new awareness campaign, some statistics that are newer related to Louisiana. And I know I'm preaching to the choir here because we're all advocates, but I hope some of this information can give you more momentum and facts to share as you're advocating for policies and programs related to obesity treatment. And then I will end with a few minutes talking about one of the studies that we're doing here at Pennington, the Team Up study, where we're actually working alongside pediatricians and dietitians to deliver weight management counseling to families in the primary care setting. So as Rebecca mentioned earlier, I'd love to take any of your questions or comments at the end of the presentation, and I hope that this might start and continue a dialogue about how to treat obesity seriously and to treat obesity as a disease. And so let me start by sharing with you Pennington's new logo that was just announced a couple of months ago. So we've changed our branding a little bit, and hopefully you'll start seeing this in more of our publications. And with this, we also launched our new Obesity USA campaign. Hopefully you've already seen this, but if not, I wanted to take a moment to share with you some of the basic tenets and principles of this campaign, because we'd love for all of you on the call to pick up this campaign and the work that you do and lean on it and use it to amplify the voice of the efforts of all of us to try to increase prevention and treatment efforts for obesity. And so in early May, our Pennington Biomedical Research Foundation launched the Obesity USA campaign, the State of America, population 115 million and getting bigger by the day. And as Rebecca mentioned, this campaign is about shifting the perception of obesity, that obesity is not willpower. It's not, there's a myth that it's all about willpower, that we're choosing, whether what we're eating and how much physical activity we're getting and whether we have obesity or not. Instead, obesity is a disease that has been recognized by the American Medical Association. It's in the ICD codes going back to 1948. And there are effective treatments that are available that have decades of science behind them. And in fact, Pennington Biomedical, we've been at this for over 30 years now, developing and testing medications, surgery, and behavioral and lifestyle programs to help people to treat their obesity. There's also a very important environmental component too, and I'll focus mostly on that the next couple of slides. This idea that no matter what we do in terms of trying to make healthy eating choices and physical activity choices and so on, our environment, as we know, is not conducive to healthy choices. I think in terms often of children, and that might be a good way to start when you think about a child who wakes up and is served certain food at breakfast and goes to school and is served portions of food for school lunch and doesn't get to choose really how they spend their time. So oftentimes they'll spend 8 or 9 hours sitting at a desk at school. Many children don't have PE or recess, or if they do, the PE doesn't involve much physical activity. And many children, especially throughout Louisiana, don't have the opportunity to walk or bike to school. And again, they'll come home and often are surrounded by media, screens, devices. So spend a lot more time sitting. Many kids are growing up in neighborhoods that don't have sidewalks, that don't have parks that they can walk to, or basketball courts or gyms or so on. And so it's really tough for kids growing up to try to make healthy choices. But the same can be said for their grown-ups, for the adults as well. And as we start reflecting on our own day-to-day life, here I am sitting talking to you at my computer, and I spend 8 or 9 hours a day at work sitting doing work on children's physical activity. But oftentimes our choices are really constrained to the food outlets that we have access to. We know many families don't live near grocery stores. They get a lot of their food through corner stores, so they don't have access to fresh fruits and vegetables, to lean proteins, to whole grains, et cetera. And so that's really the premise of this campaign, is to shift that narrative so that people start to understand, just as we think of cancer and other diseases, that obesity really needs to be taken seriously, and that we all have a stake in this game of figuring out ways that we can improve our environment, ways to implement policies to support programs that will be sustainable to help people achieve a healthy weight, and to really prioritize obesity just among how we fund and prioritize cancer, heart disease, diabetes, and to understand that obesity does underlie many of these other serious health conditions. And so what I'll do these next few slides is share with you some of the collateral material that we've used with the Obesity USA campaign. You're welcome to reach out to me, to Bonnie, and then I'll have a couple of email addresses at the end too, if you'd like to learn more or partner with us on any of these campaign materials. So here are just a couple of the interesting facts, and I do encourage you to go to visit obesity.org if you'd like to learn more. Where fast food restaurants outnumber grocery stores 6 to 1. And actually, we know that ratio is even worse in our lower income communities. There have even been studies looking at schools and how many schools are surrounded by fast food restaurants. So when you're thinking of busy families picking up their kids from school, trying to grab some food to go home for dinner, that fast food outlet is going to be a lot easier and oftentimes less expensive than stopping in a grocery store. Where 1/3 of our TV ads are for junk food. There's been a couple decades of advocacy to try to remove junk food TV ads from children's programming, such as cartoons on Saturday mornings. And that did get, quite a bit of traction, but we know now that most kids aren't sitting in front of a traditional TV to consume their media. They're getting TV shows and videos and other programs through smartphones and tablets and laptops and so on. And that's really less regulated in terms of the types of ads that they're seeing, the branded characters that they see. And again, I tend to focus in terms of children, but this is also true for adults too, when you're constantly being immersed and surrounded by ads for junk food, as well as for sedentary screen time options. Another thing that's compelling about this particular statistic is that we see that among our minority communities, for example, African American children and Hispanic children, that they see far more ads for junk food compared to white children. And so I think this is really alarming and something that we could do something about, that we could work with the TV regulators and policymakers, as well as the food industry themselves, to try to reduce this type of exposure, similar to what was done with Joe Camel and smoking advertisements. Another fact, more on the diet front, is where you can have dessert for breakfast. We call it a muffin. And so I'm sure you're all familiar with pictures that show the increase in the portion sizes over the past 40 or 50 years, where a muffin used to be much smaller in the 1950s, 60s, and 70s than the muffins that we eat today. Similarly, you can look at, a soft drink the size of a Coca-Cola, and just, that 64-ounce Coca-Cola that people are drinking, and how many calories and sugar is in a drink like that many of our kids and adults drink on a daily basis. So again, I encourage you to go to the website because you can find some more of these compelling statistics. And I think these are important for the work that we all do, because oftentimes you need a hook like this that really resonate with people, that they think, in my daily life, I've seen this, I experienced this, my family experiences this. This is not their problem. This is really an our problem for all of us. And so just that one or two fact, I think, can really catch people's attention and make them stop and reflect on how can they be part of the solution here. A few other numbers, and again, I know that many of you have used similar numbers in presentations and your advocacy work, but perhaps some of these will add more tools to your toolbox when you're speaking to different stakeholders. So again, obesity, it's not just an individual struggle. This is truly an urgent public health crisis. And this is actually why I have dedicated my career to obesity. So about 15 years ago, when I was entering graduate school and considering what do I want my topic to be for my PhD dissertation, what do I want to spend my career on, I was recognizing at that time that obesity is, in my mind, the #1 public health challenge facing us in this 21st century. And I think that's still the case. And of course, emerging from the pandemic, we used to say that, non-infectious diseases are #1 priority. Of course, we know that infectious diseases very much are part of our lives, unfortunately, now. But we also know that obesity is exacerbating the health problems from COVID-19. We know that about 70 to 80% of hospitalizations due to COVID-19 are for people who have overweight or obesity. And we know that individuals who are infected by COVID-19 who have obesity have worse health outcomes, including severe complications and death too. And so, one thing I always remind people is that, yes, obesity is disease, but it is linked to many other chronic diseases as well as infectious diseases too. And so more than 2/3 of the US population is overweight. Nearly half now suffer from obesity, and we're on the trajectory for that number to keep increasing. If you look at the rates over the past decade or two, it's going up. And so we really need to figure out a way to arrest that, to slow that down, and to start reversing that. Prevalence of severe obesity has doubled in the last 20 years. And I think that's something that's even more alarming. And we've seen this even among preschoolers and school-age children, that the severe obesity, so for those of you who are familiar with the numbers, for kids, that would be over the 120th percentile for their body mass index. And for adults, it's when you start getting to a BMI of 35, 40, 45 and above with comorbidities. And that's where, the health trouble can really start to be seen in terms of diabetes and heart disease, et cetera. We also know that there are health disparities there too. So especially, for example, in our African-American community and in our American Indian community, we see much higher rates of severe obesity across the lifespan. And, I've already mentioned high BMI is contributing to many different diseases, including 13 types of cancer. We find that message often resonates with people, whether we're looking for philanthropic support or policymakers, et cetera, just to try to link obesity to all of these other public health dilemmas. And then, unfortunately, over 300,000 Americans die each year due to obesity and directly related to the consequences of obesity. So what's the cost of doing nothing? Well, the other angle, of course, is the economic perspective, which again can really resonate with some people who may not be in the public health sphere, but very much are mindful of the limited resources and limited dollars we have in the state of Louisiana and in this country. And so how are we investing that money that we do have, those tax dollars, and how does it affect me, my health insurance premium as well for my family? And the matter is that that obesity is very expensive, particularly in the US. And so the costs attributed to obesity are nearly $1.4 trillion every year, including, $370 billion directly for medical treatment. We see this in the labor market because we know that adults with obesity have more absenteeism and presenteeism. And we also know with children with obesity that they often need to see the doctor more often. And so that means, their parents are having to take off work and pulling their kids out of school to go see the doctor. Now, we do know through economic projections that if we can reduce obesity by 25%, that will incur just over $92 billion in healthcare savings each year. And so that would be major, for our country and for the state of Louisiana. We also know, however, that historically obesity prevention efforts have been underfunded, but there's a great return on investment. So for every dollar invested in obesity prevention, America sees a $4 return on investment because of those medical cost savings and because of those labor market savings as well. And I'll also add to this, as a researcher, we know that much of our work at Pennington has a similar return on investment for the dollars we get for research, turning that back around into direct impacts on the community to reduce obesity rates. And so historically, if you look at diseases that have been funded, for example, by National Institutes of Health and some of the other federal agencies, obesity is only a tiny proportion of what it gets funded in terms of diseases. Cancer, heart disease, diabetes, kidney disease have been much better funded. And those are very important diseases to study. But if we can invest in the study of obesity treatment and obesity prevention, that's going to have ripple effects to help these other disease states as well. So now what I'd like to do is show you a couple of just very quick 1-minute clips that a marketing agency created for Pennington as part of our Obesity USA campaign. And hopefully the sound and audio works for you, but I think these are really compelling to tell the story that we're trying to convey. And I also wanted to note that I'll share these links with Rebecca, so that way you can look at them on your own time, and please feel free to share this as well with others. And so I'm going to switch over and show you on YouTube. And so here is our first video.
3,
Charlie,
4,
you're gonna be late.
5.
Charlie. Hey.
Here comes Charlie. Hey, Invisi Nerd. Wait!
Things are slow at work.
We can't live like this. We have to do something.
Good grammar and spelling.
Okay. And Rebecca, you could hear that and see that? Okay.
Yes, the audio is good.
Okay, great. So that's the first video, and I'd be happy once I'm done with the presentation if you have feedback. But clearly this young child, which unfortunately this is not an unusual situation. We work with children every day who are struggling with being surrounded by advertisements for junk food, trying to make healthy choices, but the gymnasium is closed at school, feeling that constant teasing and bullying that comes many times with children who struggle with their weight with obesity, these environmental conditions that are outside of the child's control, and the stress within the home as well that can contribute to poor eating behaviors, etc. And then the other video I'll play is that first video was Charlie, and this next video is Ezra. So this is Ezra Ezra's quick story about her own obesity.
Right up to the scale that never fails. You! I'm thinking of a weight between 115 pounds and 115 pounds. Yes, my 171-pound mustachioed friend. Anyone else?
What about me? Can you guess my weight?
Well, if I were to guess, when it comes to your weight, guessing is all anyone ever does, isn't it? So instead, I'm going to tell you what I know. I know the healthier option often isn't an option. That you don't exercise enough because you can't. And that the joke is always on you.
Ew, she's so fat.
I know how you feel when you're stared at, and even worse, ignored. How everyone blames you, especially yourself. I know your weight is out of control because it was never in your control. Because I know it's not just what you're eating, it's what you're being fed.
I was not an athlete as a kid.
There we go. Oh, well, that's interesting. The ad is about sports as well. So, I do find these videos to be quite compelling and provides me with the passion and motivation for what we're doing to work with kids and families, especially those who struggle with their weight. That idea that weight is not oftentimes directly in our control, but I think as a community and society, there are many things that we can do to make significant strides on the reduction of obesity. And so Obesity USA, our goal at Pennington is to eradicate the obesity epidemic by the year 2040. And so what I think about that is, the year is 2021, so the baby's being born this year. By the time they are graduating from high school and moving on to their careers or moving on to college, that we will be back to the levels of obesity that we saw 40 or 50 years ago, rather than obesity becoming a disease that's affecting the majority of the people in our country. And so it's time to get fed up, and we do think we need to work together. These videos can be emotionally charging for some people and quite pessimistic. But the good news is that, as I mentioned earlier, there are treatment options and prevention options that have been shown to work. And Pennington Biomedical has been a part of much of the research that underlies that. There's still more to be done. I think number one is getting access to these programs and treatment options, getting buy-in for the prevention efforts, getting more funding to make sure that patients who have obesity have insurance coverage and have the trained providers, healthcare providers and physicians who will work with them to help them to lose weight in a healthy way, in a sustainable way. We want to improve the education of the complexity of risk factors and really end the stigma as well about obesity, and make sure people do understand it's a treatable disease. And then finally increase the funding so that we can continue to do really top-notch research to inform the treatment and prevention efforts. And so what I'll do next is I do have a couple of email addresses. Again, you're welcome to reach out to Ted or to Rebecca if you're interested in learning more about the campaign or working alongside us on this. I did want to share a couple of statistics. So again, we just launched this campaign about a month and a half ago, early May. And since then, people from over 54 different countries have visited the Obesity USA website. We have aired television and radio ads across the country in 35 different cities, from Anchorage, Alaska to Tallahassee, Florida. We did have some initial philanthropic support that allowed for some of that initial coverage, but now really it's catching on. And so we're getting quite a lot of free exposure too, because reporters are recognizing that this message really resonates with the public and that people are interested in learning more. And so in just 1 month, the Obesity USA campaign has resulted in over 20 million views and engagements with people all over the world. And in the next week or so, Obesity USA posters are going to go up in bus shelters and shopping centers in Washington, D.C., Philadelphia, the New Haven, Hartford, Connecticut area, Boston, Massachusetts, and Los Angeles, California. And so we hope that this will really start that conversation and start making some really concrete changes for policies and programs. And for all of you on the call, since we're all advocates for Louisiana, this will also continue to help elevate Pennington Biomedical's name too as the best nutrition center in the US, if not in the world, for the study of obesity. We're recognized in the scientific field as being the best. That's how we get, this wonderful NIH funding and continued support and so on. But we recognize that we need to make sure that our lay public, as well as our public health officials, our policymakers, et cetera, hear about the great work that's being done at Pennington Biomedical. So I know many of you on this call are advocates for us, and I want to say thank you for doing that. And hopefully this provides you more tools to use. And so what I'm going to do next is spend a few minutes sharing with you some updated Louisiana statistics and information. I'll go through this quickly because we can share the slides afterwards. But again, we're trying to freshen up all of this information for you so that you're welcome to use this in your presentations or in your meetings and so on. And then the last few minutes, I'll tell you more about the Team Up study for children and families. And so here's a graphic that I think is really nice in showing how obesity affects just about every organ and organ system in the body, and why it's very important to invest in obesity as a way to then make sure that we're reducing all of these different diseases and the medical complications and costs that come with it. Another way to look at this, and this is particularly compelling when we're working with different regions of the state or working with legislators to make sure that they understand how this impacts their constituents, is the prevalence of obesity across every parish, which is quite high, when you compare prevalence of obesity across the rest of the country. And we do see some higher prevalence in the rural parishes, among lower income populations and minority populations, but frankly, it's high everywhere. So obesity is something that is affecting every demographic in our state. And I could show you a similar map that shows prevalence of diabetes, hypertension, cancer, Alzheimer's, and dementia, which we know are all interrelated. It's costly to Louisiana. And so diabetes, we know, is very closely linked to obesity. People with obesity have a much, much higher likelihood of developing type 2 diabetes. We see this, of course, in adulthood, but we're also seeing this more and more among adolescents, and we're seeing the convergence of diabetes is much faster among adolescents as compared to adults. And so you can see some of the statistics here specific to Louisiana for what diabetes costs us and how much of the population it affects too. And there continues to be a percentage of the population that has undiagnosed diabetes too, so that's not controlled or treated, which is troubling. We also know that all of these obesity-related diseases cost the state quite a lot of money, but that if we can invest in obesity, we can then, of course, help to reduce these costs across the board. And so you can see here that the adult obesity rate only 20 years ago was just under 20%, and it is already up to 36%. That is an incredible increase in just a very short amount of time. And so that we know 20 years from now, if we continue on this path, we'll be up to 45% of the adults having obesity and another third having overweight. And so if we truly invest in change, policies and treatment access, that we could get that down to 25% by the year 2040. And finally, the Team Up study is one way that we're tackling obesity. We have many other studies going on at Pennington as well. This is one that I'm most passionate about because I lead this study for the state of Louisiana, and it's funded by the Patient-Centered Outcomes Research Institute, PCORI, which is a nonprofit organization that was established through the Affordable Care Act. And the monies for PCORI come from a $1 per life tax that is paid by every health insurance company in the country. And the idea behind PCORI is to do comparative effectiveness trials. In other words, to compare different treatment options that are in clinical settings and to try to figure out which options are best for which patients. So we're trying to do research studies that see, which treatments are most effective, but also trying to provide more information so that when the patients are in the clinic and when the doctors are talking to their patient, they can really understand, here's a treatment option you should consider, here are the risks and benefits, here's the potential outcome that you might see. And so for Team Up, we are comparing 2 different clinical treatments for childhood obesity. And we have in mind the families to make sure that they have more information about treatment options, the actual doctors and nurses and dietitians and social workers, so that they have more resources and curriculum to follow for weight management counseling. And also the payers. I'm very happy to share that Blue Cross Blue Shield of Louisiana, Louisiana Healthcare Connections are 2 of our main partners on this study and provide funding and support. And many other insurance companies also are starting to step up to the plate to cover obesity treatment, which is required by the Affordable Care Act. And so we're starting to see that insurance companies are indeed covering this treatment. And so we're comparing what we call the enhanced standard of care. We are training, now it's up to 150 pediatricians. About a third of those are in Louisiana, a third are in New York, and a third are in Missouri. And the American Academy of Pediatrics is training them on weight management counseling techniques, because most of our doctors aren't receiving this training in medical school. We're lucky if they even get training on nutrition. Some report that they might get an hour or 2 on nutrition. And so this is, of course, a gap that we're trying to fill by providing them with resources and opportunities to talk with each other and learn from each other on effective weight management approaches for families. And then we'll compare that where the family sees their trained doctor over the course of a year to families who also get a trained health coach who's been trained in family-based behavioral treatment. This is a treatment that's been around for about 30, 35 years. It's considered the gold standard treatment for weight management for children. This involves going to see, oftentimes it's a dietitian, it might be a social worker, could be a trained health coach. The family meets with them on a weekly basis for about 6 months, and then every other week thereafter. And it's an opportunity for that coach to work with the family to create tailored goals in terms of eating, physical activity, how to change the child's school environment, their home environment, how to make sure that the whole family is making a commitment to healthy choices and healthy weight, and how to really start to address some of those environmental challenges that I talked about earlier. And so overall, we're recruiting 728 parent-child dyads. Here in Louisiana, we've enrolled about a half of our total sample size. We need 243 total. And so over this next year, we'll be looking for more families to join so we can finish recruitment for that study. One really exciting thing about Team Up is that not only does it strive to reduce child weight and has been shown to be effective in both treatment arms to do so, but also parent weight too. So the parents join the child in all of the sessions, and we've shown then that the parents can lose weight with this approach as well. And so here's a map of where the Team Up study is occurring at Washington University, here at Pennington, and then University of Rochester, as well as the American Academy of Pediatrics, who provides training for our doctors. I'll skip through this, a little bit more details. Right now, the study is going on in the greater Baton Rouge area. Our Lady of the Lake system is part of this, as well as Baton Rouge Clinic, both their main and industrialplex locations, and Red Stick Pediatrics, who serves children insured by Medicaid. We're also working in Greater New Orleans with Ochsner, as well as Access Health Louisiana through 2 of their community health centers. So we're very happy to have these partners. As I mentioned, we've got, I think we're up to 50 or 60 doctors and nurses who are trained and part of this. We also have other grants under submission that will work with additional health systems too. So we're always looking for partners if you're interested in partnering with us, whether you're an insurance company or a healthcare system or provider or whatnot. I'd love to hear from you to see how we can work together to continue expanding access to this type of treatment. And finally, I'll just end by encouraging you to follow us on our social media, our website, go to Obesity USA. And at this point, I'd love to hear if you have any questions or feedback from the work that I presented.
We do have one question in the chat box from Audrey. She asked, why were the areas chosen for advertising for the campaign? I think when you had mentioned like Los Angeles and Washington, D.C., a couple other cities, was it more for just the most engagement with community members or obesity numbers? What was it really based off of?
Yeah, so thank you. That's a great question, Audrey. I'll be honest with you, I don't know the answer to that, but I could get that for you. I will tell you that Pennington has worked with a variety of different marketing firms over the past year and a half to develop this campaign. So I would assume that they probably have advised us in terms of reach and access to go into large population centers, as well as probably some of their connections too that they have to some of these cities. And our goal is to really, we want to focus on Louisiana in our community, but we also have a lot that we can do out throughout the US. And just as, you know, you can name St. Jude or MD Anderson or many other sites that are known throughout the country for their work on cancer research, we want to make sure everyone throughout the US recognizes when they think of obesity research and chronic disease research, they think of Pennington Biomedical Research Center, and they see us as an expert and a trusted guide to them to help to prevent and reduce chronic disease.
I might also add that these public service announcements are something that all TV stations and newspaper and social media have access to. So all of them, I know everyone's seen public service announcements on various TV, and they'll hear radio. So this is what this is. It's a public service announcement. So many of the stations are more than happy. We're also going to be doing the same type of advertising to educate public. So you may see them on billboards, in subways. They also do public service announcements. And if I can just add, I misspoke when I was doing my briefing. I said for some reason that HB 150 by Senator Barrow with the bariatric surgeries, that for some reason I said 30 a year, but it's 300 a year. So thank you for people who brought that to my attention. So I did mean to say 300, excuse me.
I also wanted to mention that the 2 videos I showed you, as well as a lot of the campaign material, were tested out this past year as well among different communities throughout the US, including African-American communities and different geographic areas as well. And overall, it seemed to really resonate with people, and it was overwhelmingly positive responses too. And so I thought that, you know, we're a research center, so we like to test things out before we actually launch them. And so I think that probably speaks to why this campaign has been really successful over the past few weeks. And hopefully through your work picking it up and others, the word will continue to be spread.
Is there any other questions? We have the Q&A box. If anybody does have questions, you can type the questions there for us to view. Whether you have questions for Dr. Ciano or for Bonnie. Not seeing anything right now. I actually have a follow-up question to like the advertisement and recruitment for, it was more of the recruitment for the team up study. You had mentioned how y'all are recruiting in Greater Baton Rouge area, Missouri, and New York. Is there a reason for certain recruitment in those 2 specific cities as well?
Mm-hmm. So we've got investigators in each of those 3 regions, myself here at Pennington, and there's a scientist in Missouri and a scientist in New York. The one in Missouri, Denise Wilfley, 30 years ago helped to develop the family-based behavioral treatment, and she's really known throughout the country and the world as one of the leaders in this area. So that's exciting for us because we are now able to have her team train coaches in Louisiana with the best evidence-based practice related to child obesity treatment. And then Steve Cook is the investigator in New York, and he has a lot of high positions with the American Academy of Pediatrics. He himself is a pediatrician too, so he provides that clinical perspective that we need, and he's very well versed with billing and reimbursement too. So that was one reason we chose those areas. The other is if you look at the sociodemographics of these regions, one of the focuses of Team Up is to make sure that we're reaching children who are insured by Medicaid or who are uninsured. And so we know, of course, Baton Rouge and New Orleans, that there's a lot of population that doesn't get sufficient healthcare access, yet there are some excellent community health centers and other clinics that serve mostly Medicaid patients that we're able to work with. And one of the goals is this is not a research study where we just want to go in, do the study, and then once we leave, it ends. The whole point is sustainability. So instead of sending Pennington coaches in or Pennington staff in, we're training the clinics doctors. We're training the clinics dietitians and social workers. And for those who didn't already have that type of allied health professional, we're providing some seed funding for these clinics to hire dietitians and social workers who will start off by working on Team Up, but they're also taking on caseloads with other diseases as well. And through working with the insurance companies and getting coverage and payment for the services, the whole point is to then make it sustainable so that once the study does end, those clinics can continue to offer these services to their patients.
If I might also add, NIH often will have these studies, or in this case, PCORI, that they really want collaborations from around the country. And Pennington is known in our 32 years, we're known for collaboration. In fact, our very first research project, we collaborated and continue to collaborate with the Department of Defense. So there will be various clinical trials or population-based studies that we collaborate with other academic health centers, hospitals, FQHCs in the state. So if you're interested in possibly, if your organization is interested in collaborating, Pennington has a rich history and we would love to collaborate. So just contact Amanda or I and we'll point you in the right direction for that, because since we don't have really hospitals and clinics, we are known to collaborate throughout the state and then throughout the country and in some cases throughout the world.
Let's see, I think we might have another question. Are the families that participate in the Team Up program incentivized anyway? Just curious since it's a monthly process.
Yes, thank you, Audrey. And also, I'd be happy to share my contact information. I see Kelly asked, and Audrey too, if you wanted some more details. And so the families do receive compensation up to $200 for being part of this research study. They get paid for every, what we call research assessment visit that they come to, which is every 6 months. That's to pay them for their time, their transportation for doing the study. We also provide, some health promoting merchandise, like we'll give them measuring cups and a water bottle and a gym bag and things like that. And in many cases, the treatment itself should be free to them. Under the Affordable Care Act, child obesity treatment should incur no out-of-pocket expenses. And so through Blue Cross Blue Shield and through the Medicaid plans, we've, working with them to make sure that that's the case. And then we're working with the other insurance companies as well to make sure that these programs are available to the families without having to pay out of pocket to see the doctor or the dietitian.
I have another question as well for you, Amanda. Is there, I know we were talking about advertisement earlier, and that's something that I've noticed. I watched, I don't know if it was me watching regular cable or Hulu or one of those, and it was 2 or 3 advertisements. It was fast food, then it was like a sugary cereal or some kind of candy. So it was junk food, like at least 4 to 5 of the advertisements, and then maybe one that was about something completely different. And so is there anything that as a state or that y'all are doing to work on this, to get that advertisement out of television some kind of way, or even like watching YouTube and different things like that? Is there anything that y'all are specifically working on to kind of help with that? Is there anything the collaborative, people in the collaborative can do to kind of help with that?
That's a great question. And that might feed into what Bonnie had mentioned earlier, is we're looking for these types of urgent matters to bring to our state legislature. And so this might be one that we want to rally around and get a group together to talk about. I will tell you, I lived in DC for a number of years when I was at Georgetown. And at the time, a lot of progress, like I mentioned, had been made on your traditional TV shows. Back in the day when people actually turned on their TV and watched all of their shows that way. And some great progress was made in terms of both the industry self-regulating, but also the FCC regulating what ads were allowed during children's programming time slots, cartoons, and to really start to dial back the amount of junk food ads. I have not kept up with that work. I have not seen anything that indicates that has been successful in getting into the YouTube space or the online spaces, which we know that kids are spending a lot of time there, as are adults. I'd be happy to kind of, Rebecca, take a look at that and see if anything's being done in the advocacy world. I would say there is a certain amount that needs to be done at the federal level, but there are probably things that we could make happen at the state level too, as well as being an advocate to the federal level, to our members of Congress, to try to support initiatives like that. If we could just get some of the billboards away from schools that are advertising, fast food outlets, I think that would be a great start.
Yeah. Well, thanks for that answer. Don't see any other questions in the chat. So I think that will conclude our presentation for today. So thank you both for joining us. I appreciate having both of you on the collaborative, as well as just a partner with so many different initiatives that we have going on with the collaborative, with the Department of Health, with Well Ahead. Like Bonnie was saying, I know y'all collaborate with so many people throughout the state and throughout the country. So we are very lucky and pleased to have Pennington in our hometown and our state. So we're looking forward to seeing what kind of policy changes can hopefully take place from this campaign and from this study. So we will definitely love to invite you back to give more feedback in another year or two, to just let us know kind of where everything is going. But I know we'll also send out communication as things do change moving forward with this. So I appreciate all of that information, and we will share in the meeting notes. I think Amanda, they asked if we could share your email. If that's okay with you, I will put that in the meeting recap. I will also send out all of the links to the trainings and webinars that we had listed. I will send the Louisiana Obesity Commission's email address as well. Well, when you get the email, you'll have that. But reach out to that email with any questions you may have. Also, we will have the recording and just a brief summary of today's meeting on our Well Ahead website. And you can find that at wellaheadla.com. And so that will be linked to the meeting notes as well. And so I will include the walpen.org email address that we normally do as well. So you can join that group if you are interested in getting updates on our provider education network. Also, as we look forward to the next couple of months, hopefully the work groups will be reaching out to their members to schedule meetings in July and August. And then Our next meeting will be in September, and we have a tentative date of September 16th. So if you want to pencil that in, it is going to be a Thursday again, I believe. So if everybody wants to put that as a hold, we will send a save the date about 4 to 6 weeks in advance. So thank you all again for taking the time to meet with us, for joining us today. Once again, thank you to our guest speakers, and we appreciate all of the support. Y'all have a wonderful rest of the week.
Thank you.